I'm Michael Battelle, president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, as part of our patient focused series, Liver Insights 2, Illuminating the Path Through MASLD and MASH, I'm excited to introduce Dr. Mazen Noureddin, who's a transplant hepatologist at Houston Methodist Hospital. Dr. Noureddin is internationally known for his research in MASLD and MASH and is an expert in patient care. Today, in part two of our special series for patients who have already been diagnosed with MASLD or MASH, we will be discussing the stages of MASLD and MASH and what they mean with regard to your liver health. Dr. Noureddin, most patients watching this now know that they have some form of fatty liver disease and told that they have what is medically called now MASLD and MASH. What do patients need to know about this disease or this spectrum of disease?
Yeah, Michael, thank you for having me. As always, it's honor and pleasure to be on your important programs and podcast and Zoom interviews. You increase awareness significantly, and I'm glad to talk to our beloved patients about this and those who are curious to know what is happening. And if you don't mind me, I can show you some slides, Mike, about
Sure.
the disease transitions and all this. So, and I think a lot of people now know, what is called MASLD. It used to be called NAFLD, right back in the days, Mike. And this is a disease that when fat accumulates in the liver, secondary to metabolic syndrome, usually people are overweight or they have type 2 diabetes or dyslipidemia. And a lot of people initially, when they don't know anything about liver, their first reaction is like, "Oh, doc, I don't drink." And this is this concept that used to be called non-alcoholic fatty liver. And because of the stigma with the non-alcoholic terminology as well as fatty, we changed the terminology to MASLD, which is more reflective of the disease and means metabolic associated dysfunction, steatotic liver disease. So it's MASLD now. So it's basically fat in the liver. In lay terms, we use metabolic now without drinking alcohol, and it's related to other conditions that it's in the body. And this is the disease, Mike. The MASL happens, or what used to call NAFL back in the days, when fat accumulates in the liver, and you see these fat droplets here, the white stuff. Then over time, it does progress to more advanced form, which we call it MASH now, which is steatohepatitis. And this is basically when this fat becomes inflamed and the cells get swollen. And this inflammation and the cell injury or cell damage is a problem. And what caused this initially is the fat. So on top of the fat, once you start getting this cell damage and inflammation, you move to the right, and this is when the scarring starts. And this is a bigger problem. This is I guess, the fire that we don't want to. The reason why, because this scarring eventually scars, and I'll get to that figure in a second. Scars start accumulating, and you see this on the right. It's like the amount of that blue here is cirrhosis. That full circle of blue is cirrhosis. That's an issue because the liver usually is kind of like soft, like a sponge, and does a million things for the body. But when it scars like blue, like this, like full circles in the body, it becomes cirrhotic. It becomes like a hard drug, and that's what you don't want. And that's what it looks like in this picture that keeps popping up. This is the liver is rough, scarred, and I call it like a rock. And that causes problem because the function starts decreasing over time. The job is not doing its job properly. And that rocky feeling pushes back on the veins in the body. We get varices, you get fluid in the stomach or the abdomen, you call it ascites. So that is a problem. And those what we're trying to avoid in these patients and discover the disease early. And those are some of the complications. You see this abdomen, Mike, I told you before, this is the ascites or the fluid in the abdomen, and that's what what you're trying to avoid in these patients. Once you get to this level, it's quite late, and liver transplantation is warranted, and you need to refer patients to the transplant center. You see this patient who's trying to do this. This is an exam we do to look for what we call it encephalopathy, meaning confusion. And what happens is because when you get to cirrhosis, the liver does not clear the toxin. Initially, when you get to cirrhosis, things still working, but then the liver starts struggling. I call it the liver is limping now, and then
Mhm.
eventually it gets crippled. And this is when you get the fluid in the abdomen and you don't clear toxins, so people gets confused. And we call it encephalopathy. And the way we examine for this, we examine it by asking them to hold their hands, and you see them flipping like that. And finally, look at this blood. This is a camera inside the food pipe or the esophagus, where you see these bulge things where the blood is coming from. Those are the veins, and we call them varices. This is because the hard rock liver is pushing back on the veins in the food pipe and causing this esophagus and causing these veins, the varices, to swell and eventually they rupture. And those are all like morbid conditions, deadly complications sometimes that we need to avoid. So that's kind of like 30 seconds snapshot of the disease progression. My job as a hepatologist every day to discover the disease early before it gets to that hard rock situation. And luckily now we have treatments for uh, this steatohepatitis with scarring. So quite advancement within the last year, and we need to keep an eye on preventing complications, right, Mike? I'll stop here and see
Okay,
if this.
so I have a bunch of questions on behalf of
Yeah,
patients I'm
yeah.
thinking. So, how long does it take? And there's probably not one right answer because it depends on the person, their genetics, and all their life environment. But how long does it take from the time that they start to develop fat until the time that it may get to that very serious level that you just shared?
Yeah, so I mean, people, there are multiple studies. Each stage is about 6 to 7 years on average. So the disease might take up to 20 years to get to that. But there are two problems with that here that I would not like just, oh, I have time. I'm gonna wait and
Yeah.
see like what happens over time. One, in most of the cases, almost 100% back in the days, and less recently get discovered really late. So a lot of patients come to us about after 10, 15 years of the disease, and sometimes after 20 years of the disease with the complications. Fortunately, and hopefully, that will is getting better with the recommendations of screening in high-risk populations, such as those with type 2 diabetes. The other point I want to make also, there are some people that they called rapid progressors, that this time frame you kind of get expedited and people get to cirrhosis within a short time. So I say, yeah, it takes time, but the question is, when did you discover this? And how, because it's silent disease, so people will not complain about it, except like, some little bit of pain here and there, especially the right upper quadrant, like the right side of the body, and some fatigue. And they say, well, it's life, it's being overweight and all this. So that's why I caution people to take it seriously once they discover it, even if they have risk factors to be screened for it.
Okay, so and it might be in part the same answer, but I just want to ask it a little differently. I know a lot of people who found out that they have, I'll still call it fatty liver disease, just to keep it simple, but fat in their liver, including myself. And I did a fiber scan, and it was, over 70% of my liver had fat in it because it was like what they call the 319 in this CAP score. And I did take it seriously, especially because I'm trying to set an example for people. But a lot of other people who find out, it's like, you know what? I got enough problems in my life. I don't want to start dealing with that. It's not bothering me right now. I'll worry about it when I have to worry about it. So for for those people, what do you say to them? And they're your patients that you talk to all the time. So maybe to you, they're going to say, "Okay, doctor, thanks for telling me. I'm going to work on reducing my weight and do some more exercises and all that." But what about people who say, honestly, they're going, I'm not really going to do anything about this because I got enough things going on in my life. What do you say to them?
Well, I mean, there are two types of people, right? So the first type, to simplify it, if they have significant scarring in the liver, they need to see a liver
That's it.
doctor and start a treatment. There's no one tells you, hey, you have a little bit blockage in the heart in two, three arteries, and you say, well, I'll see you in 5, 6 years.
Yeah.
You need to
No.
take it seriously, right? You don't want a heart attack with that blockage. Same thing when you have significant scarring of the liver, significant fibrosis, you gotta see a hepatologist. Before that, you still you cannot ignore yourself. You cannot just let go, you know? If you don't have blockage in the heart, but your diabetes is not controlled, your cholesterol is not controlled, this and this, eventually you're gonna get heart disease. Same thing for the liver. If you don't control the diabetes, the cholesterol, the high blood pressure, and reduce the fat in the liver, eventually the liver will scar, and it cause you like way more complications and way more symptoms than
Later.
anything else. So, um, why not get healthy? Why not live right? And why not do preventative medicine rather than waiting until the last minute, last second, and then I guess things hit the fan.
And I, there's a lot of data, especially in the last year or so, that show that most people are dying not from the liver, ironically, because it's such a great organ, but from cardiovascular disease. So if somebody actually has a heart attack and dies from a heart attack, you don't go back to say, "Oh, let's check the liver to see what happened to them," right? So it's identifying these diseases early, so you don't get to that point that the liver's causing these diseases. So I think when people have family members that are passing away from things like cardiovascular disease and other metabolic disorders, even more reason for them to take the liver disease seriously when they find out.
And
Uh,
they go hand to hand, right?
yeah,
If you're fixing the comorbidities and losing the weight, things get better overall, the heart and the liver. On the other hand, also, it's not always the heart that gets you in trouble. When you get this significant scarring, and that's what you need to see a liver specialist, hepatologist, or gastroenterologist.
right.
Liver takes over and lead to eventually, unfortunately, death and or needing full liver transplant. No one wants any of those.
And I think my last question for you is we always talk about MASLD and MASH like it sounds like two different diseases. And it really, to me, it's one disease that's a spectrum of complications and severity. Is that right? Or do you see it as
Yeah.
really two or more? If you look at the new nomenclature, I guess it's a lot of different diseases now, or are they just really descriptions of the same spectrum of disease?
Yeah, the MASLD is under one umbrella. It's MASH is continuation of the MASLD, which is MASH is the more severe disease, and then eventually, when you get to scarring, that's even worse, and cirrhosis is the outcome that you don't want to. So it's a continuous disease. It's with different severities, and once you have the disease, you gotta watch for the subsequent severe cases of it and try to prevent it. So keep an eye on that.
You don't want to be any busier than you need to be, so let's keep people
That's
healthier to
true.
start with. So
That's true. Not have it at all is the best thing, right? Of
no, I agree. And as always, thank you so much for sharing your
course.
expertise with patients, and we'll make sure to get the word out to everybody so they can do what they can.
Yeah. Thank you, Michael, for
Thank you.
what you do and keep it up.
Thank you.